As we age, our bodies go through many changes. Some of them are normal and expected, but others can be signs of health problems. One thing many people over 60 notice is itchy skin. While most itching is harmless, there are some itchy spots that may be signs of something more serious. In this script, we will talk about 4 unusual places on the body that can become itchy after age 60 and what these itches might mean. These areas are the scalp, the lower legs, the back, the palms or soles. We'll explore what causes the itching, what health problems could be linked to it, and when it's time to see a doctor. Let's begin. Chapter 1. Itchy scalp. Could it be more than dry skin? The scalp is one of the most common places people feel itchy, especially in older age. Many times, it's just dry skin or dandruff. But if you're over 60 and your scalp is very itchy and nothing seems to help, it may be a sign of something more serious. Common causes. In older adults, the skin on the scalp becomes thinner and loses moisture. This dryness can cause constant itching. Other times, it can be caused by using harsh shampoos or hair dyes. Some people also get itchy scalps from wearing tight hats or wigs. But what if none of these apply? What if the itching doesn't go away, even after changing shampoo or treating for dandruff? Possible health concerns. 1. Scalp psoriasis. Psoriasis is a skin condition where the body makes new skin cells too fast. It can cause thick, scaly patches on the scalp. It's not just about the skin. It's also linked to immune system problems. 2. Liver disease. The liver helps clean the blood and get rid of waste. When the liver isn't working well, waste builds up in the body. This can lead to itchy skin, especially on the scalp. Itching from liver problems is usually worse at night. 3. Iron deficiency. Not having enough iron in the blood can cause itchiness, including on the scalp. Iron helps carry oxygen to cells. When you're low on iron, your skin may feel irritated and itchy. 4. Nerve problems. Some nerve issues can cause a feeling of itching, even when the skin looks normal. This is called neuropathic itch. It can feel like crawling, burning, or tingling. When to see a doctor. If your scalp is red, scaly, or crusty. If the itching wakes you up at night. If you have other symptoms like yellow eyes, tiredness, or weight loss. Chapter 2. Itchy lower legs. A clue to circulation issues? Many older adults feel itchy on their lower legs. This may seem harmless, but in some cases, it can point to deeper problems in the body, especially with blood flow. What causes itchy legs? As people age, skin gets thinner and drier. This makes the legs, especially the shins, more likely to itch. Lotions and moisturizers can help. But if the itching is constant or comes with other symptoms, it might mean more. Possible health concerns. 1. Poor circulation. The lower legs are far from the heart. If the heart isn't pumping blood well, or if blood vessels are blocked, the skin may not get enough oxygen. This can lead to itching, numbness, or swelling. This is called peripheral artery disease, PAD. 2. Diabetes. Diabetes affects blood sugar levels. Over time, high blood sugar can damage nerves and blood vessels. This can lead to dry, itchy skin on the legs, feet, and hands. If you have cuts or wounds that heal slowly, this could also be a sign. 3. Kidney problems. The kidneys filter waste from the blood. If they aren't working well, waste builds up and causes itching. The legs and back are often where this kind of itch starts. 4. varicose veins. These swollen veins, often found in the lower legs, can cause discomfort, heaviness, and itching. The veins become twisted and don't move blood well. This poor circulation can irritate the skin. Other signs to watch: swelling in ankles or feet, skin that's shiny or discolored, sores that don't heal, tingling or numbness. If you notice these signs, it's important to get your blood pressure, sugar levels, and kidney function checked. Chapter 3: Itchy back, a sign of internal illness. The back is a large area, and many people complain of itchiness there. It's easy to blame it on dry skin or sweating, but sometimes the cause is something inside the body. Why does the back itch so much? Skin on the back is often neglected during skincare. We usually can't see it or reach it well. Because of this dryness, rashes or spots can go unnoticed. But when the back itches constantly, it might point to deeper problems. Possible health concerns. 1. Notalgia paresthetica. This is a nerve condition that affects the upper back. It causes a deep itch that doesn't go away. There's usually no rash. The itch comes from pinched or irritated nerves, often in the spine. 2. Blood disorders. Some blood cancers like lymphoma or leukemia can cause itching all over the body, but it often starts on the back. This itch is usually severe and not helped by lotions or creams. 3. Cholestasis. This is a liver problem where bile can't flow properly. It can cause intense itching, especially on the back and arms. People often feel worse at night. 4. Allergic reactions to medications. Older adults often take many medications. Some drugs can cause skin reactions, including itching. If your back started itching after a new medicine, that might be the cause. What to look for: persistent itch with no rash, itch that gets worse at night, other symptoms like fever, weight loss, or swollen glands. Chapter 4: Itchy palms and soles, hidden signals from inside. Itchy hands or feet may not seem like a big deal, but when it happens often or becomes intense, it might be your body telling you something is wrong. Why do palms and soles itch? These parts of the body have lots of nerve endings and sweat glands. They're sensitive to heat, pressure, and irritation. Sometimes dryness or eczema causes itchiness here, but other times it could be linked to internal diseases. Possible health concerns. 1. Liver or gallbladder problems. When the liver or gallbladder is in trouble, bile can build up in the blood. This can lead to itching, especially on the hands and feet. People with hepatitis, gallstones, or liver failure often have the symptom. 2. Thyroid problems. The thyroid controls many body functions, including skin health. If it's not working right, it can cause itching. An underactive or overactive thyroid can lead to itchy palms and feet. 3. Allergies or food sensitivities. Sometimes your body reacts to something you ate or touched. This can cause redness, swelling, and itching. Common triggers include nuts, shellfish medication, or even certain soaps. 4. Hodgkin's lymphoma. This type of cancer affects the lymph system. One of its first signs can be itchy palms and soles. This kind of itch is very deep and not relieved by scratching. Other things to watch: yellowing of the skin or eyes, fatigue or weakness, swollen lymph nodes, changes in bowel habits. Prevention tips and home care. While it's important to be aware of serious causes, not all itching is dangerous. Here are simple things you can do to care for your skin after age 60. Use mild fragrance-free soap. Apply moisturizer after bathing. Drink plenty of water. Avoid very hot showers. Wear loose, cotton clothing. Use a humidifier in dry weather. If itching lasts more than 2 weeks, keeps you awake at night, or comes with other symptoms, it's best to talk to a doctor. Chapter 5. Why chronic itching should never be ignored. It's easy to think that itching is just a surface problem, but that's not always the case. Itchy skin, especially when it doesn't go away, can reflect changes inside the body. Chronic itching may be one of the earliest signs that something deeper is wrong. Itching that continues for weeks or months is known as chronic pruritus. This kind of itching doesn't respond well to over-the-counter creams or soaps. If you're over 60 and you have chronic itch in any of the unusual areas we discussed earlier, it's important to treat it seriously. Why does chronic itching matter? First, it can greatly affect your quality of life. Constant itching can lead to trouble sleeping, mood changes such as irritability or depression, skin damage from constant scratching, infections due to open wounds or sores. But more importantly, it can signal deeper issues like nerve problems, organ dysfunction, or systemic diseases. Chronic itching may be an early symptom of cancer, autoimmune disorders, or hormonal imbalance. That's why paying attention to how long the itching lasts, how intense it is, and whether other symptoms are present is key. It's not about panic. It's about awareness. Not every itch means something dangerous, but knowing when to look deeper can help you stay ahead of potential issues. Chapter 6. The connection between skin and internal organs. The skin is often called the body's largest organ. It acts as a barrier, protecting us from infection, dehydration, and harmful chemicals. But it also reflects what's happening inside the body. Skin and internal organs are closely connected through the nervous system, blood vessels, and hormones. When an organ such as the liver, kidney, or thyroid isn't working properly, it can trigger symptoms in the skin. Itching is one of the most common skin symptoms related to internal problems. Let's take a closer look. The liver helps clean the blood and process nutrients. When the liver is struggling, waste can build up and cause itching. This often happens without a rash and is most intense at night. The kidneys remove waste through urine. If kidney function is poor, toxins can accumulate and irritate nerve endings in the skin, causing itchiness. The thyroid gland controls metabolism. If it's underactive, the skin becomes dry, cold, and itchy. If it's overactive, it may cause sweating and irritation. Diabetes, which affects blood sugar levels, can damage nerves and cause itchy skin, especially on the legs and feet. Poor circulation also leads to dry skin and slow healing. In short, the skin doesn't act alone. When it's trying to tell you something, listen. It could be speaking on behalf of your entire body. Chapter 7. When itching comes with no rash. One of the trickiest kinds of itching is when it happens without any visible rash. You feel the urge to scratch, but the skin looks normal. This type of itch is harder to understand, but it's often a bigger red flag. Here are some reasons why itch with no rash may happen. Nerve damage. Conditions like shingles, multiple sclerosis, or diabetic neuropathy can cause the nerves to send false signals to the brain. You feel itchy even though nothing is wrong with the skin itself. Liver or kidney problems. These internal issues often cause itching without any visible change in the skin. Iron deficiency or anemia. Low levels of iron in the blood can cause general itching. Cancer. Some cancers, especially blood cancers, may cause a deep itch with no rash. Psychological causes. Stress, anxiety, or depression can sometimes lead to skin sensations like itching or crawling. What's important is to track how the itch behaves. Does it move around? Is it worse at certain times of the day? Are you feeling tired, weak, or losing weight? These clues help doctors figure out what's really going on. Chapter 8. Keeping track. What to write down before seeing a doctor. If you decide to speak with a doctor about your itching, it's helpful to keep a record. This gives your doctor a better chance of figuring out what's causing it. Write down the following: when the itch started, where it happens most, whether it's worse during day or night, any new foods, soaps, or medicines you've used, other symptoms like weight loss, fever, or tiredness, any family history of skin or internal diseases. You can also take pictures of the skin daily if any rash appears. Some rashes come and go quickly, and showing pictures to your doctor can help with diagnosis. Be honest about everything, even if it seems small. Sometimes it's a small detail that helps solve the puzzle. Everyday habits to reduce and prevent itching. If your itching is caused by dry skin or mild irritation, some simple changes can help relieve and prevent it from coming back. Moisturize daily. After showering, apply a good moisturizer to trap moisture. Look for creams with ingredients like urea, ceramides, or glycerin. Stay hydrated. Drinking enough water keeps the skin moist from the inside. Avoid hot showers. Use warm or cool water instead. Hot water removes natural oils from the skin. Choose gentle soaps. Fragrance-free. Dye-free soaps are less likely to irritate older skin. Wear soft clothing. Cotton clothes are gentle and breathable. Avoid wool or rough fabrics. Use a humidifier. Dry air, especially in winter, can make skin drier. A humidifier adds moisture to the air. Avoid scratching. Scratching makes itching worse. Keep nails short and use cold compresses or anti-itch lotions to calm the skin. Watch for triggers. If certain foods, medicines, or fabrics make the itching worse, write them down and avoid them when possible. These small steps can bring big relief and help protect the skin as it ages. Final thoughts. Itching is common, especially as we grow older. But when it shows up in unusual places like the scalp, lower legs, back, or palms, it's worth paying attention. These itches could be more than skin deep. They may be signs of health problems that need care. Don't ignore itching that doesn't go away, especially if you're over 60. It may seem like a small thing, but it could be your body's way of asking for help. Stay aware, take care of your skin, and always check with a doctor if something doesn't feel right. Early attention can make a big difference in staying healthy and enjoying life in your later years.